This is going to help with that rotational movement with the ball and socket joint. Just like we did for the hips, work on rotation first before we do the flexion and extension. And that tension right there on that posterior shoulder, and what she's going to do is she's going to internally and externally rotate her arm. There you go. Now, she's just going back and forth, working on that. Now, if the ball is too much and you just want to work on the range of motion, that's okay. We're killing two birds with one stone here. We're digging into that tissue while adding rotational movements to it. Now, you see how she's pretty limited? Remember, in the exam, this is the thing we're working on. She's gonna stop right here, gonna take the other hand, put it here. She's going to try to put the hand she's stretching, she's pushing up into the resisted arm, and then relax, see if she can go further. Push again, relax, see how it's going further each time. And then when she's there, I want her to try to now push that arm into the ground, hard as she can, try to own that movement, and then relax. Now she's gonna go the other way. Same thing, she's gonna take that arm, put it here, push into that arm, relax, good. So this is your 90-90 type movements. Okay, next you'll need a PVC pipe, a stick, a broom handle, whatever. All you're gonna do is you're gonna help assist you with internal and external rotation and then flexion and extension. This is the S part. Okay, what we're gonna do is for setup here is you're gonna put your arm here, PVC pipe is gonna go to the back part of your forearm, you're gonna grab it, your other hand is just going to be exactly where you have it here. And what you're going to do is you're going to pull that arm, which is causing the external rotation here. Now you can add where you're trying to push against it with the stretched arm and then relax. See if you can go further each time. Now you see here how my arm is straight in front of my body, working here. Now you can bring it out to a 45-degree angle, and then you can kind of bring it out to the side if you want to hit differing type movements in the shoulder. Go into a half kneeling position. We're gonna try to take the lower extremity out of the equation. What she's gonna do is she's gonna have her arm nice and straight, body's nice and tall. What she's gonna do is she's gonna hip hinge, so lean over like you're bowing. And if she needs to, she can move this arm up and try to drop that mid back down as much as you can. She's stretching that lat as far as she can, and she's getting this arm back over her head if she can, okay? Now here we're gonna add a little bit of extra movement to it. She's gonna try to lock out her arm, and she's gonna try to pretend like she's driving this pole into the ground with her arm only, and then she's gonna relax and see if she can go a little bit further in. Push down again, relax, see if she can go further down. Now I'm gonna add, at the very end, we normally add breathing, but I wanna try to activate the musculature here. Can she pretend like she's gonna pick the pole off the ground that much? Pick it up, pick it up, pick it up, and then relax. She's activating that area. You're trying to hold it for a good 5 seconds if you can. For working, that was flexion. Now we wanna work on extension. She's actually gonna be in a hip hinge position. She has her arm locked out. She's gonna try to see if she can raise this arm as high as she can. Don't go as high at first, kind of back off a little bit because you're about to see a major stretch. So since she's bent now she's gonna sit nice and tall, and that's gonna cause her body to now have a lot of extension right here in this shoulder. Okay, now what she's gonna do here is she's going to try to push down into the ground, push, 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 and then relax. If she can bend again at the hips, go up a little baby bit, grab it, sit up nice and tall. There it is. Bring that shoulder down, this one, there you go. Good job. Good, okay? Then relax. Now see how she's wanting to rotate? I would say that's too high for her. Kind of take the tension off, go down a little bit. Now make sure you're square, then now come up. Bring that shoulder down. There it is. A little bit different, huh?
Yeah.
Okay, so make sure that you're gonna try to, now that she's here, drive that arm to the ground. Good, relax, relax, relax. Good. Now, after she's done it a few times, I wanna see if she can pick up this pole off the ground. Pick it up. 2, 3, 4, 5. Good. What you're doing, you can relax, is you're trying to teach that movement to actually, hey, it's okay for you to do it, earn it, and it'll actually change your shoulder mobility drastically. This is the MSA approach for shoulder mobility. Another phenomenal glenohumeral joint, ball and socket joint that has tons of mobility, and if you lack it, it's gonna cause all kinds of problems in that mid-back, elbow, of course the shoulder, and then the neck. So do it.